does your perfect healthcare system look like?
Perfect healthcare system for me would be, first of all, at full capacity, where we've got enough people to deliver care to the population. That obviously would be, that's the first criteria, because that's an area we battle in. But I think it would really be one where people have a single view of the patient and the family. And when I say people, I mean the healthcare providers should have a single view, and then the people who are receiving the care should have the single view of the system. So it should be an easy to navigate system where care is accessible, high quality, no doubt, but that you have a continuum that people know where to interact with the system, and that they interact with the system at the correct point. And usually that's with prevention, early screening, early diagnosis, and proper treatment, so that you can avoid those down the line, more unintended consequences of more serious illness and hospitalization.
So one thing you mentioned was like having enough staff to just be able to, provide the care that we need. And right now in healthcare, we're facing a huge, shortage in terms of especially our frontline staff. So what do you think needs to be done to help support this and to make sure that our healthcare system is sustainable over the long term?
Well, it's not an easy task. Otherwise, I think, we would have done it. I don't think anywhere in the world, has got a perfect healthcare system. But very definitely we need to make sure that healthcare is a safe and supported environment to work in, that people feel that they are safe and supported. They need to feel like they're making a difference, be recognized. And then it comes down to financial as well. I think it's not always easy working in the healthcare sector. There are so many other places that people could make, a better living, that people are often looking for arts. So I think it comes down to being, adequately paid, appropriately paid, and then having the right working environment with all the supports in place, but also regular feedback on the difference that is being made in people's lives. All of that sounds very easy, but it's a long journey to get people there. And obviously we need to make sure we're training enough people. That for me is a critical thing as well. And internationally, I don't think we're doing that. Well, I think internationally we're not training enough people, because I don't think we can rely on people coming from other countries. I know in my time in South Africa, I used to go to medical conferences, and at the break, you'd come out and there'd be a Canada table, an England table, and an Australia table, waiting to essentially poach. And obviously it was a great opportunity for people, but South Africa is now in a situation where they've imported doctors from Cuba. We've got to look at ways of making sure that our capacity is sustainable and that we are getting enough entrance into the system in these countries.
Recently, I was speaking to a couple of leaders who did a research study at Sick Kids Hospital. The study looked at whether providing career development services for nurses would actually help to retain more of their staff. And they did find that people had positive feedback and they felt like they were, in an organization that cared for them and cared for their development. So do you see this as a potential, strategy in terms of, helping our frontline staff or even middle managers being more valued at work or finding more meaning where they do work?
Oh, definitely. I think, as a system generally, and this even happens internationally, is we're not good at recognizing experience. So if you're a family physician with 4 years experience, or a family physician with 40 years experience, there's very little differentiation in the way you're viewed, or the way you're remunerated, or the opportunities you get. Same thing happens with nurses and therapists and PSWs. We definitely have to have some way of looking at career laddering, and that doesn't have to mean promotions, but that can certainly be new specialties, new ways of using people, new ways of getting value from them, and new ways of them teaching the next generation. So very definitely recognizing that experience that people get is a way of keeping people in the workforce, because it can be frustrating if you've been doing the same thing. You don't see any change for yourself given 10 years on or 20 years on. So very definitely, I think we've got to do a better job of that.
Especially as a PSW, as a nurse or as an OT, PT, an allied health member, you're sort of capped, when you reach a certain point. So you lose that incentive, and it's so different. You've worked at, in some of the other sectors in insurance and the other, banking, corporate world. It's very different. So are there some things that we could bring into healthcare to leverage those things for our own employees, for our own patients? What are your thoughts?
Very definitely. I mean, if you're looking at PSWs, I mean, it goes without saying they are play an enormous role in our society and in the healthcare system, and we need to find ways of making sure that we're recognizing that the experience that they're getting and the value that they're offering. That can be through a number of things, because different people are going to want different things. But you may have PSWs who want to, while they're working, do an RPN course and then go on to being an RN, and then maybe even going into leadership. You may have PSWs who want to specialize in end-of-life care or certain disabilities or certain special needs. So I think ongoing development to make sure people feel like they are moving. And it's not going to be for everyone. Some people are very happy doing what they do, building the relationships, and we need that whole spectrum. But for people who want to see change and have that development, we've got to be able to offer that to them as well. And then with that has to come some form of recognition from a experience point of view and from a remuneration point of view as well.
And at Closing the Gap currently, do you have opportunities for that ongoing development for staff in those roles who are potentially looking at, moving into leadership roles later on?
We're looking at it, and we have education programs for our PSWs, and we have education programs within the organization. But as a system, I don't think we've done it well enough, because we're not funded to do that. We work in the home care environment largely on a fee-for-service environment. So unless someone's delivering service, we don't get paid for that service. So it's not an ideal setup for that. So I think we need to look at ways of funding people through that development. And there are some interesting government initiatives that are looking at PSW education. And I applaud that. We obviously need to do a lot more with the scale we need, but very definitely I think there's huge scope for providing that career laddering for healthcare professionals.
That's such a great point, because it's all tied back to the funding. And in healthcare, it's, the funding is directly related to patient care. But sometimes we forget to see how that funding ties into, developing a leader at a higher level that will then funnel into patient care that's much better, right?
Absolutely, sure. You definitely get back that investment in the vast majority of cases where you are investing in people. They're going to be the future in delivering care or leading people who deliver that care. So very definitely, it's an absolutely critical part of it.
Along with your team at Closing the Gap, you've started a number of really amazing initiatives to address employee wellness, such as, you sent out care packages, you were doing Fun Fridays, you had meeting-free Mondays and Fridays. What impact has that had on your staff, on employee engagement, in terms of your overall, organizational priorities? And do you think these practices are going to become a norm once we start coming out of this pandemic?
So first of all, the sort of things we did, I mean, I think we always realized employee engagement was a critical piece for any successful organization. I think, no one would dispute that. What we saw with COVID was that there was an increasing sort of COVID fatigue. People were working enormously hard. People were stressed, not only because they had to work, but, people have personal lives as well, which could have involved childcare, caring for their parents, a number of things, or spouses with having lost jobs and source of income. So it was critical for us to say, what could we do for our team that would alleviate some of that stress? So there were some real things, and there was some so communication for me was critical, and we made sure, as did I'm sure many organizations, make sure we were communicating regularly with our entire team through various town halls, smaller meetings, just giving people an idea of what we were doing, what we were expecting, what advocacy we were doing on their behalf, because they were feeling, sometimes that they were working and not being heard. So those sort of things, communication was critical. The other was, we've also found for our administrative teams and for our leadership teams, they were spending an enormous amount of time in meetings and then having to catch up on other things after hours. So we looked at a number of things we could do. One of the things was we put a ban on internal meetings on Monday mornings before noon and Friday afternoons after noon. And that was really just to give people time to catch up, slow down, or if they had got their work done and they wanted to actually go off early on a Friday, also fine. People know how much, what they have to deliver. You don't have to tell them when and where to deliver it. So we implemented that, and I think that has taken some of the pressure off. Also done a number of other things, implemented small gift vouchers for people going above and beyond. Just small ways of recognizing thank you cards for people who've gone above and beyond. And then, as you mentioned, our Fun Fridays, where people can join in on a trivia questionnaire on a Friday, and there were prizes for that. Again, just trying to get the team to work as a team and to see each other, because again, working in home care generally, you're a dispersed workforce, and then on top of that, with all the work from home, we were really only seeing each other on screens. And only seeing the people that we usually interact with. So it was really an opportunity to get people to see each other and to interact between teams. I'd like to think it's made a difference. We've in fact just launched a very quick pulse survey. We launched earlier on this week, and the survey is open till the end of this month, just to get an idea how our team is feeling, about how engaged they're feeling and how they're feeling about some of the things we've done. So we'll get a good idea then. But certainly, on a more selfish note, I can tell you I've enjoyed it, because I have engaged with a lot more of the team than I usually would. And it's been quite gratifying for me when I've sent out messages, getting responses from members of the team as well, just telling me, what was good, what was bad, what more we could be doing. So from my perspective, actually, I've become more engaged with the team since the pandemic started than I was pre-pandemic. So lots of learnings for me as well.